Now, as part of efforts to eradicate malaria in Ghana, government has launched a national malaria elimination strategic plan. The plan, among other things, aims at reducing malaria mortality by 90% by 2028 and reducing malaria incidence by 50%. Launching the strategic plan, Minister for Health Kwekwagyamanu expressed his optimism that Ghana has the capacity to eradicate the disease, considering the success of the National Malaria Control Program. My colleague Kwesi Adai has more.
The Malaria Elimination Plan is an ambitious strategic plan aimed at achieving zero malaria in Ghana by 2028. The strategy is inspired by the success stories of other African countries like Algeria and Cape Verde in eliminating malaria. Minister for Health Kwekwagyamanu says the new eradication strategy will replace the current National Malaria Control Program.
Malaria has remained a priority disease under the government's policies and initiatives and has traveled several progressive milestones to ensure high coverage of evidence-based interventions to combat malaria through the National Malaria Control Program and now the National Malaria Elimination Program.
Program Manager for the National Malaria Elimination Program, Dr. Kezia Mam, revealed the specific targets the strategy seeks to achieve.
The first goal is to reduce malaria mortality by 90% by 2028. And this goal is to take us to near zero by 2028. So I'm hopeful that by 2028, whoever will be looking at the strategic plan at that time will now be saying that nobody is dying from malaria. We also want to work to make sure that by 2028, the numbers that we are seeing in our health facilities are reduced by 50%.
On his part, Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, stressed that the negative socio-economic impact of malaria makes it imperative for the country to eradicate the disease.
That the socio-economic impact of malaria has been said already is significant. The disease imposes a heavy economic burden on households, the health system, and the national economy. Malaria-related illnesses and deaths lead to lost productivity, absenteeism from work and school, increased healthcare costs, as well as personal costs. This can result in reduced economic growth and development.
Representing President Akufo-Addo, Presidential Advisor on Health, Dr. Anthony Nsiansari, also mentioned government is ready to ensure the full implementation of the new plan.
I take this opportunity, therefore, to assure you of government's commitment in providing the political will and the resources to support the deployment and implementation of the various strategies and elimination activities.
Eradicating malaria has been a long-term vision of Ghana following its commitment to the Abuja Declaration on rolling back malaria in 2000 and the Millennium Development Goals. The plan, when successfully implemented, will ensure that Ghana becomes malaria-free.